Hi there, my name is Gerard Green. I'm from the UK. So we're here on the 25th of August. I'm in Birmingham in the UK, and it gives me great pleasure to speak to Montse Rejano Campo, who's based in Dusseldorf in Germany. And Montse is a really fascinating person because she's from Spain. So she's worked as a pelvic health physiotherapist in Spain. She's also spent several years working in France, and now she's working in Germany. And she does several things. So she's got a real kind of clinical background in female pelvic health. She's also involved in a lot of teaching in female pelvic health. She has many years experience of teaching physios how to do ultrasound imaging in female pelvic health. She also teaches other courses that we will speak about. And she's also involved in research. And I think what we're really interested in, or I'm really interested in, particularly what happens in pelvic health in France. Because in the UK, we always hear that France is the most perfect place to have a baby. So we'll talk about that. But I think also because the global PT community has got really interactive and close, we're also going to find out what happens in Spain and what happens in Germany. So, Montse, a really big welcome to you.
Hi, Gerard. It's a very big pleasure to be here with you today.
Do you want to just tell us a little bit about what you do?
Yeah, so I'm a physio. I'm doing a lot of women's health, physiotherapy, and yeah, so I did my studies in Spain, as you said, and so I finished my bachelor degree in 2007, and I was working for only 1 year in Spain. I went to the Canary Island because it was like a nice weather there.
Yeah. Good idea.
But then it was really good. I really started with manual therapy and a little bit of women's health. But I realized that I really wanted to move, and I've always liked to travel, and I decided to move a little bit and go to France to discover other languages, other cultures, but also other ways of working. So it was really a really big experience for me to work in France because, as you said, women's health is really well developed there. And so I learned a lot, and I started working with women, teaching also ultrasounds and women's health ultrasound. And yeah, I discovered my passion. I think it's a really amazing world. I don't know what you think, but I think working with this kind of population, which are still a little bit taboo. I don't know, maybe in the UK if it's the same thing, but I feel like people don't speak a lot about.
Yeah, that's very true. Even in the UK, that's very true. That's very true.
And yes, I find the communication with this kind of populations is really amazing. The education that we can provide to this patient is just amazing. So I decided to go deeper and start my Master of Science in manual therapy in Spain. But I was working with pelvic girdle pain. So okay. my research project was this one, and yeah, then I started being involved in clinical research in women's health. But yeah, so currently I'm working in Dusseldorf and teaching in several countries in Europe and doing clinical research.
Brilliant. That's brilliant. So you see, so we're going to get a real insight into what happens really in France, Spain, and in Germany. So I think what people are really interested in, Montse, is we hear lots of things about pregnancy, postnatal physiotherapy, pelvic health physiotherapy in France. So we hear that, mums get really good care and that they get lots of postnatal physiotherapy. So what's the reality? So if on average, if a French woman has a baby, what happens to them in terms of postnatal physiotherapy?
So yeah, as you said, I think France is a country with a really great culture in pelvic floor rehabilitation, and I think almost all the clinics in France offer treatments for this kind of disorders, and yeah, I think that's why, as you said, there was like a very good postnatal care, which was proposed systematically to every woman that gave birth. So that was unfortunately until 4 or 5 years ago. So all the women had systematically 10 sessions of pelvic floor and abdominal muscle training after childbirth. And yeah, I think that that's really an extraordinary way to educate women on pelvic health issues and patients' awareness of pelvic health. That's a very good to get the population to know the importance of these issues and make people to talk about, because as we said, it's like a taboo, and it is very important to talk about it. And yes.
And what happens now? Like, so you said it changed about 5 years ago.
Yeah. It was, I think, 5 years ago. So the French College of Gynecologists do not recommend pelvic floor physiotherapy systematically for every woman. Only for the women who has symptoms, urinary incontinence symptoms. And that happened because there was like a systematic review, which was published by a team of gynecologists in France, that conclude that the treatment in postpartum urinary incontinence. So I say it again. So this review conclude that the physiotherapy care was effective for the treatment of urinary symptoms in patients with problems, but it was not preventive.
Right.
And therefore, then was a Cochrane review, which says that in fact there is a preventive effort of the pelvic floor muscle troubles. But that was a big systematic review, and the college decided to follow and to change the guidelines. So now they try to, the gynecologists are not more prescribing systematically these sessions. They choose the patients. And yes, I feel that it was a bit like a kind of step backward, because I think it was a great opportunity for the patients to regain like to knowledge and to train and to know what's happening. So,
and are many patients seen now postnatally? Are many patients seen now or many women seen now postnatally by a physiotherapist?
I think there is still, because is this something that is stayed like kind of in the culture, and I think that gynecologists are quite concerned about urinary incontinence after childbirth. But yeah, so it's not so systematic. But I think still a great number of women receive this kind of treatment, which is like pelvic floor muscle training and abdominal wall training, posture, yes, more global exercises, and so on. And normally this is totally reimbursed by the social security. So the patients are not going to pay nothing. And that's a very important.
Right.
And I think also in the moms, so there is a complete reimbursement from the 6th month of pregnancy until the day 12 after delivery. So every treatment that these women received will be reimbursed by the Social Security, 100%. And then we have these 10 sessions which are going to be also reimbursed. But yeah, normally now it's only if they have like urinary incontinence symptoms. But still,
so would you say, in your experience, among French women, that there is more awareness of conditions such as urinary incontinence, prolapse, pelvic pain, rectus diastasis, pain on intimacy? Is there more awareness within those women that these are not normal conditions, that they should that there is help there, and that maybe physiotherapy is part of that help?
I think there is more, at least more than in other countries in Europe. And I think really that the social security system helps to that. And because, yes, I think they are really aware of urinary incontinence problems and maybe diastasis, and prolapse is not very common, you know, but we treat that also. But yeah, in the general population, I think they are aware of mostly urinary incontinence. It's like the big thematic, I think.
And this kind of leads into probably, so we asked people, did they want to ask you any questions?
Uh-huh.
And they did. So
really?
probably, so Ramona Horton is a really close friend of mine. So Ramona is a really esteemed physiotherapist from the United States, from Oregon in the United States. So I think her question is that when some of those women are seen postnatally,
mm-hmm.
are they individually assessed
Yes.
and given individual treatment, or is there just a protocol or a series of exercises that they're giving?
No, they have 10 individual sessions of normally 30 minutes, and they are individually evaluated. Normally there is like an intracavitary examination systematically, and then like a pelvic floor muscle training, and also an abdominal approach. I think so midwives are also taking care of pelvic floor muscle training after childbirth. And I know that there are some different methods which are more visual, like they work with images, like for example, a bridge which open.
Right.
And, do you know this? Do you have that in the UK?
Not the bridge one. So yeah, tell us about
the cave. There is like a cave and a bridge, and yeah, that closes and opens and so on. But which is in fact recommended by the associations, is really to have a proper intracavitary evaluation with the strength, endurance, reactivity, rapidity, so the perfect stream, right. And then to see if there is like a abdominal, so abdominal is working properly, and the posture and so on. And then we try to go really progressively. And I see that's very, I think in other countries is much more like gymnastics, and just check if there is a contraction on the pelvic floor, but maybe on external ultrasound and so on. So here is more like when you go to the gynecologist, and really you make like a
right. So lots of internal assessment.
Yes, and then you try to bring to the function to these patients, and then maybe you can use like biofeedback, ultrasound, or EMG. And
so you're obviously very interested in using ultrasound imaging.
You know, I really love it.
And that's something I'm really interested in as well.
Okay.
So in France, not that we're obsessed with France, but we are, in France, do many physiotherapists use that to assess pelvic floor function, or is that uncommon?
No, not at this moment. I hope it will, but because I think it's a really precious tool to understand as a physio what's happening on the pelvis, but also for patients to discover and to educate the patients how things are working. That's very, very important. But yes, I think in France there is not much. I think I'm giving some courses I'm the only one at this moment giving courses on pelvic floor ultrasound in France, and yes, it's not very common. They are more like using biofeedback, EMG, and palpation.
But I think in the UK it's pretty similar in that it's some people are doing it, but it's definitely growing. So it's definitely getting more popular.
Yes, I remember my first course was with you and Ruth Jones. And
yeah, Ruth. Ruth really tried.
interesting.
Ruth really was instrumental in kind of really encouraging physiotherapists to look at the pelvic floor differently, and particularly in using ultrasound imaging, which she did her PhD on.
Yes, I read it.
And
interesting work.
And then another question was, which kind of fits in with Ruth, because Ruth was really inspiring to get more people into pelvic health physiotherapy. And someone asked a question, well, how does someone train as a pelvic floor physiotherapist in France? Because I think what interests me is that it sounds like lots of women see a pelvic floor physiotherapist in France. Yeah. So that means that it sounds like there are lots of those physiotherapists. So where are they all coming from? Where are they all being trained? Because we don't really have those big numbers in other countries.
So it's quite strange because now physios are studying physio for 4 years, 5, because there is like a first common year and then 4 years, and there is not much content on pelvic health.
Same here.
So that doesn't happen at the university. So in some schools they have only 20 hours in 4 years. Some others have a little bit more. But there are a lot of professional trainings which are proposed to the physios who already have their diploma. And so there are a lot of professional trainings which are also reimbursed by the government. So the government is proposing like sometimes a total reimbursement of these trainings, and sometimes like a partial one. So normally physios are really going on post.
So are they weekend courses, or is that like a formal postgraduate master's in pelvic health physiotherapy or a postgraduate diploma?
You can find both, like a small courses from 2 to 6 days, but also like proper university programs which are more structured with very specific content on urodynamics, and so which normally are organized by gynecologists in collaboration with physios. But it is not necessary to have this kind of university programs to propose pelvic floor therapy to patients.
And are there many of those formal postgraduate diplomas or masters running in France?
I think there is at least 5, 6 of them.
Because in the UK we have one. In Australia, there's one, so they're quite difficult to. So there are 5 or 6 in France.
Yes. There are a lot of them, and they are sometimes not specific for physios. So midwives can also come, and doctors who are also interested in pelvic floor physiotherapy, they can also assist. So they are not specific for physios. But yeah, maybe more. I don't have a count, but really I know there are a lot of them. And in Spain also they have like a lot of university programs, even masters in pelvic health. And that is 1 or 2 year masters. So a lot of people is also doing great things in Spain.
Yeah, no, that's because and I suppose that brings us nicely to maybe just tell us what happens in Spain then.
What happens in Spain? So I have less experience in Spain since I've just worked for 1 year there, and I was not so specialized in pelvic floor therapy, but I work with my colleagues and I give courses there, and I see so a lot of things are happening there. People are more used to have like Master of Science. They do like PhDs on pelvic health. So a lot of things are happening there. And yes, maybe the methods are a little bit different. I don't know. They are doing a lot of hypopressive,
Right.
you know, and
Yeah.
there are like some other methods like the 5P, which is a method with a trunk. Do you know it?
No.
No. So that's a method with you have like a platform, and then the patients are going to go up on this platform and do like kind of a proprioceptive.
Oh, right. Yeah.
That's called 5P.
Yeah.
That was, I think it was initially created in France, but it's not so performed in France. And I guess in every country we have like a specific uh, methods to see the pelvic floor, even if there is like a pelvic floor muscle training properly, where you train the pelvic floor muscles, force and strength and endurance. That's the most common and established, and which is recommended by the professional associations. There are also a lot of different other treatments which are not so studied in clinical in research. So there is not much evidence about them, but they are really, really often performed in clinical practice. In France, we have, yes, also hypopressives. There is also other methods like the gasket or Gerard. I don't, have you heard about them or not?
That's a new one on me, I'm afraid.
No?
I'll have to get on Google.
Yeah, so those are like also postural methods with breathing training and pelvic floor
And
muscle.
so it sounds like pelvic health physiotherapy is really strongly established in Spain, with lots of formal roots into that specialty with those university courses. So in Spain, is there a good awareness of pelvic health physiotherapy among the public?
I think it is, but the problem and the difference is that these treatments are not reimbursed. So the patient
Right.
has to pay.
So people have to pay. So that's a bit like here. Most people, a lot of people would pay for it privately.
Of course. So for this reason, the physios propose more like group sessions. So also they have like also
Right.
private sessions, but a lot of patients cannot have an access to this kind of treatment because they don't have the means. And yes, I think the professionals in Spain and have a lot of experience and a lot of knowledge, because there are like so many options at the university and so many like programs. But yeah, the problem, the difference with France is about the reimbursement. So the population is aware of the pelvic health.
Yeah,
but
they've got to pay.
The access is
which
more.
Can be a barrier. Which can be a barrier.
Yeah. So I mean, it's hard to have both, but I hope that's going to, I don't know, that is going to be included in the social security system, because the social security system in general is not bad. Normally every treatment is 100% reimbursed, but they are less reimbursed treatments than in other countries. I mean, if you have a fracture, you won't pay anything.
Yeah,
but
yeah.
You have like a more specific problem,
You pay.
You pay, or you have a private insurance.
And in kind of France and Spain, do you tend to get a lot of musculoskeletal physios who also do pelvic health physiotherapy, or is it very much you have pelvic health physiotherapists and you have musculoskeletal, or do you get people who will do both?
I think most people do both.
Oh, that's good.
So in France, most people do both because they start with general musculoskeletal practice, and then they start like to having some patients, because since every woman, so a lot of women are doing this postnatal care, there are a lot of women asking for this kind of treatments. So the physios are going to, okay, what should I do for that? So I'm going to have like a professional training and to be able to see properly this patient. But then there are some physios which of course are more specialized than others, but I think most of them are like doing both.
That's really good, because it's obviously a better way to assess, treat, and manage those patients if you do both.
Yes, and I think it, as you say, is good, but it is also important to take in account both. If you have a patient with a low back pain or a pelvic girdle pain, it is really important to evaluate both. Does this patient have like urinary symptoms? And the opposite, if you are seeing a patient for a pelvic problem, just to evaluate what happened at the back. Do you have pain? Do you have other? And because we see in the literature that both conditions are quite related, like back problems and incontinence and pelvic problems.
But I think what's really useful what's a really good way of getting the musculoskeletal physios engaged in pelvic health is teaching them how to do ultrasound.
Teaching with ultrasound, with your
So if with the musculoskeletal physios, if you even teach them transabdominal ultrasound, that's a nice way for them initially to explore what's happening in that pelvic floor. So at least it's kind of a safe way for them to get involved. And a couple of weeks ago, I spoke to Dr. Judah Thompson in Perth, and she was really passionate about that one way to bring more of those musculoskeletal physios into pelvic health is to teach them how to do transabdominal ultrasound imaging.
Yeah, I think that you are totally right, because it's a really non-invasive way to see if the pelvic floor is contracting or not. Of course, I think there is not there is also a problem, because if a physio who is not like performing a proper physical therapy on pelvic health, and he has like an ultrasound machine or an ultrasound device, and he thinks he can also do like a proper pelvic floor treatment only by transabdominal approach, and that also can be dangerous. I mean,
of course,
it's important to establish the limits and say, okay, you can see some things, but of course you have to be critical with. But
I suppose the ideal then is you get some of those musculoskeletal physios starting to do that. So then they start to ask the questions about maybe female pelvic pain, prolapse, urinary, and then they might pick up that this woman who's come with back or hip pain may have a pelvic floor dysfunction, and then they get better at referring those women to someone like you or their colleague who is a specialist. And I suppose that's what we do in our clinic. We've got prolapse specialists, we've got bowel specialists, and I think our musculoskeletal physios, because they work with us, they'll now pick up, they'll have women coming in with maybe back pain or thoracic or shoulder pain who've got endometriosis, who've got urinary symptoms, who've got pain and intimacy. Whereas I think 5-10 years ago, they weren't asking those questions, whereas now they are. So I suppose it's getting those musculoskeletal physios. I suppose it's bridging that musculoskeletal physio and pelvic health physio.
I think I totally agree with you.
And then it's like you're like a source of knowledge on every European. It's almost like a Eurovision Song Contest here. So next we're going to go to Germany. So I think in my experience, so I've been to several WCPT conferences, and you don't tend to come across too many physios from Germany. And in terms of the courses we run in the UK, we get loads from Iceland. We get some Portuguese physios, we get some French, Spanish physios, we get loads from Scandinavia. But I think we've only had, in all the years, I think we've only had maybe 2 from Germany. We had a guy from Germany did the Men's Health Online, and then we had a lady from Germany come to do one of the internal courses. So what happens in Germany? Because Germany is different, isn't it, for pelvic health?
Germany is different, yes. So first of all, I think the studies in Germany are, for the moment, are not at this European level. That means that the studies is 3 years studies.
Right.
And They have like not a university degree. Since several years, they started to proposing also a bachelor in physiotherapy, which lasts between 4-5 years, which is more with a university approach, like more research, and then the physios can have an access to a master degree. But the level of the physiotherapy in Germany is changing now, but it's a little bit different. And I think the physios are not doing a lot of pelvic floor ultrasound. There is the Physio Association of in Deutschland, which is really trying to get physios on that, to involve physios in clinical research, in university programs, and so on. And they are also like proposing programs, specific programs on women's health and pelvic health, sorry. And that's like, I think they have like a module which lasts, so 4 modules. They propose 4 modules for 2 days, and then they make like a final exam, and then the physio can have like a kind of proper certificate. And yes, but I think it's not very useful. I went to the Continence Congress last year in France, in Germany, and I found also that the physiotherapy in pelvic health, it was not so. There was like a lot of surgeons and
I suppose it's maybe early. I suppose we see that in some countries, because you teach abroad a lot. So suppose different countries are at different levels of development.
Mm.
And so currently, then, sorry, go on.
But you know, there are so great physios in pelvic floor which are doing great work in Germany. So I don't know if you know, like Barbel Junginger and Baikla. See, they are like doing a lot of ultrasound, and I think they are like trying to bring this pelvic floor culture to Germany.
No pun intended.
They publish a study, because here, for example, for the postnatal care, normally the patients are going to do like gymnastics, and they can, I don't know, like Pilates or some specific exercises that can also include the pelvic floor. And so this team, this physios, who is a physio and a doctor, they published a paper to see the effect of this exercise on the bladder neck. So they were like evaluating these patients during the exercises, and then they were seeing that the bladder neck was going down with most of the exercises. When they were asking for a voluntary pelvic floor contraction, of course the excursion of the pelvic floor was not so important, but still. And I think they are trying to really bring this culture of a proper specific examination of the pelvic floor muscles, with which can be complete with an ultrasound evaluation. And I think that's coming. That will come.
And I suppose it's exciting for you to be there, because I'm assuming that you'll be a great help in getting involved with that.
I hope so. I hope so.
And the other thing that, like, I'm quite interested in male pelvic health. And obviously you've worked in Spain, you've worked in France, you're now living in Germany, you've taught in Switzerland, you've taught loads of places. So do you think that more people are getting involved in male pelvic health? What's your, because you know lots of physios in all these countries. So do you think, is male pelvic health growing? Is it not? What do you think?
I think it is growing, but it is still very scarce compared to women's health. Not a lot of physios in these countries are doing. So maybe in France, you have also some trainings for physios, professional trainings for physios in men's health. And yes, I think that's coming, but it's not as usual as women's health. But I hope that will come and that will grow. For example, for men's health, I think in France we have no specific university program. maybe they can improve some
Early
problems
days, early days.
you know.
And then the other thing, so in the last, it's probably 3 years now, so I've got to know two brilliant physios in the States. So Karina and Dawn. So they are both heavily involved in training physios in kind of children's bowel and bladder. So things like constipation's a big one, you know, frequency, toileting anxiety. So do you and obviously ultrasound has a big part to play in those children. So do you come across many physios on the continent who see either kind of children or toddlers or teenagers with bladder and bowel problems?
I think it's the same thing. There are some physios which are very, very specialized, who are doing great things with children. And I know a physio in France that is using like ultrasound to evaluate this population, but it's the same thing. It's not very extended, unfortunately. I think we have still a lot of things to do in this field. Also, same thing in Spain. Yes, I think women's health is like the most.
Yeah, it's the most. It's obviously the biggest area. And now I like to ask everyone this. So, what do you kind of see as the next big development in pelvic health physiotherapy? What excites you? What excites you?
I think that's something related with education, but not only on a maternity context, but also maybe at the school. Like it's very simple, but just that the teachers are also aware of these problems, because like there's like a lot of problems in the school, like teachers not letting the babies go to the toilets or
and that happens in the UK a lot. Yeah, that's a good point.
And so I'm thinking about the basic education. So really, even in sport classes, I don't know, do you have like a sport? So in Spain we have like mathematics, we have a lot of subjects, and we have also sport. And it would be nice also to include like kind of pelvic, abdominal health.
We do have that. So yeah, we have kind of sport physical education. The big problem in the UK with children is that we've got a massive childhood obesity epidemic.
Oh, really?
Yeah, and so we have really high rates of childhood obesity, and then we've got big rates of adult obesity. So I think exercise is really, really, really important to those children and adults. And because of that obesity, then it's obviously a big risk factor for bladder and bowel dysfunction. So I think we're going to see more teenagers with bladder and bowel problems probably at a younger age. So we've got a lot of very overweight children, which we didn't have probably a generation ago.
So one reason more to include also pelvic health and abdominal.
And then I suppose we are still in the middle of COVID.
Oh, yes.
So how is COVID affecting you?
Me. So I'm personally I'm really, really concerned about what's happening. I'm really, that's something I cannot understand very well. So it's like too big. It's like everything changed around us. And yes, luckily my friends, my family, everyone is okay. I'm okay also. But yes, also at the professional level, it affected to me because I'm not giving courses anymore. So all the courses in all the European countries were cancelled, and I think it will start like in some months. But yes. So for one side, on one hand, it was really hard because I was not giving courses, but on the other hand, I have more time to develop my clinical research and to read and to learn. And also, I think it's fascinating how the people look for strategies to do things. I was really fascinated by seeing people like giving webinars, like, so a lot of things were created because of that. So it's, of course, it's a tragedy.
Adapting.
We see people resources. That's so great. It's really, and that gives us like more resources. Like we know we can do that now, like online. Maybe otherwise we won't be here.
Well, I don't think we would. I think it has connected us much more than, like, I think in February, the thoughts of doing, I'd never heard of Zoom in February. Like, I probably would have used Skype a bit, but
me too.
It has connected us a bit more. And so you obviously teach lots of ultrasound. You teach lots of ultrasound with Sonoside. What else do you teach?
Sonoskills. Sonoskills.
Sonoskills. Apologies.
Yeah, I'm working with Sonoskills.
So with Sonoskills.
Too many Sono, and so I think Sono.
Do you teach ultrasound with Sonoskills? What else do you teach?
What else? So yes, I'm also teaching, since I have a big professional experience also in manual therapy. I'm also teaching manual therapy for patients with chronic pelvic pain.
Excellent.
And I'm also teaching general pelvic health, like for physios who want to be like more specialized in this field. And yeah, so those are for the moment my 3 courses. So
because what we will have to do when we can is definitely get you to come to the UK to teach for us. That would be amazing. That would be amazing.
Great.
Honored to have you there. And if COVID doesn't go away, which it probably won't, we might have to do something online here. But that would be amazing for us as well. It would be an honor to have you teach for us.
Would be so nice.
And then the other thing is, probably lastly, is you're obviously I suppose the one thing I didn't ask you is, what is your clinical research on then?
Well, that's I told you I had a lot of time to do a lot of clinical research, and I really became like crazy of my laptop, and I was like, we were not able to go out, so so I spent a lot of time on clinical research, and that was nice. Currently, I am working on several projects. One of the most recent ones is like the development and the validation of a questionnaire for the evaluation of symptoms and consequences of diastasis recti.
Oh, excellent.
And so I'm doing this work with someone you know. So I'm working with 2 physios, Laura Fuentes and Victoria Campos from Spain and University of Valencia, and also with Gronia Donnelly.
Oh, we love Gronia.
Of course,
by coincidence, Gronia is from the same part of Ireland that I'm from.
Ah, really?
Ireland is really small, but we are from the same part of it. It's really bizarre.
Oh, wow. I met Gronia in a dialysis course in London, and yes, I really it's much.
Yeah, Gronia's amazing.
It's very amazing. So we are doing this development and questionnaire because we do believe that the diastasis recti is more and more well evaluated. I mean, so before we were doing just anatomical, how much is the recti distance? Then Diane came with the study with Paul Hodges, and maybe we can do something else, and maybe there is like a function. So we can also we have also to evaluate the function of the linea alba, and then all the work you were presenting with Mira. And I don't know if we have pronounced properly her name, but also like a functional part. I'm with Samantha Aguilar, who's like evaluating the pelvic floor.
You're busy then, you're busy.
So that comes. And then what I find that it's missing is like everything which is around this diastasis, because the patients has had a lot of consequences of that. So a lot of the quality of life, body image, this inability, like they have more problems, they have a loss of strength on the muscles, which can have an impact on the daily life. So these dimensions, these more psychosocial dimensions are not so much evaluated, and that's very important. The patients with diastasis recti, they have a lot of troubles with the perception of the body image.
Very true. Yeah, it's true. It's true.
And that has to be really taken in account. I think it is really important.
And then probably last question is, what do you do outside of work to relax, especially with COVID, because COVID is quite a stress around. So what do you do to relax, or what do you do outside of work?
I really love to go outside and to walk on the mountain, the forest, and to climb. I really love this kind of sports. I like open air sports, and I really loved also to music, concerts, and so on. But it's a little bit sad because now there is not so many things happening.
Seems like the concerts may be the last thing to come back.
Yes.
Now, I'd like to say a massive thank you for giving up some of your time. It's been a real pleasure to meet you again and to speak to you. And I will look forward to trying to arrange to get you to come to the UK at some point. And if that doesn't work, we will have to, because we've done lots of work online, tons of work online. So we could maybe arrange for you to teach online for us. But thank you for your time. I think people will be really interested in what happens in France, Spain, Germany. It's like you're like it's like you've got insight into so many places. Like, it's quite amazing. So big thank you, and it's been really nice to spend the morning speaking to you.
Thank you for having invited me. It's really, really a pleasure to see you again. And yes, I hope there is a lot of things that
definitely
to do.
Yeah, just to get more people involved.
Yeah.
Brilliant. Thank you.